In this episode of Beyond the Diagnosis, let me start with a question. When was the last time you asked your patient what truly matters to them beyond the numbers and test results? Imagine a patient walks into your clinic, informed, curious, and prepared to discuss their treatment options. Are we listening as much as we are advising? The answer to this question defines not only patient satisfaction but also the outcomes we are able to achieve. Today, I want to explore how engaging patients at a deeper level and applying personalized care strategies can transform the way we practice medicine. I recall a patient who had meticulously tracked her health metrics, read scientific articles, and arrived ready to discuss every possible treatment option. Her frustration was not with her illness, but with feeling unheard despite her preparation and insight. This is a reality that many physicians encounter. Patients today are knowledgeable, empowered, and expect collaboration. The challenge for us as clinicians is to balance our expertise with their lived experience, creating care plans that are both clinically sound and personally meaningful. Personalized care goes beyond the latest technology or genetic data. It is the thoughtful integration of clinical evidence with a patient's values, preferences, and lifestyle. Shared decision-making is the framework that makes this possible. When implemented intentionally, it allows patients to weigh options alongside clinicians, creating care plans that are not only effective but also embraced by the patient. It is about moving from telling to partnering, from prescribing to co-creating. Practical strategies can make a tangible difference in clinical practice. Begin by offering at least 2 viable treatment options and explaining the risks and benefits in language the patient can understand. Ask them what matters most in their life and document the conversation. Schedule follow-up appointments to reassess decisions and provide additional guidance. Small but consistent efforts like pausing to listen, clarifying patient priorities, and using patient portals for follow-up can dramatically improve engagement and adherence. We must also recognize the pitfalls. Treating shared decision-making as a checkbox, over-relying on digital tools, or assuming every patient has the same health literacy can undermine engagement. Balancing technology with human connection is critical. True patient engagement requires reflection, experimentation, and the humility to acknowledge when strategies do not work as intended. Ethical and legal considerations are equally important. Informed consent now includes explaining how data is used, how algorithmic insights influence treatment, and the implications of personalized risk assessment. Patient engagement must be equitable, accessible, and transparent. By prioritizing these principles, physicians can innovate responsibly while maintaining trust and safety. Here is a challenge I want to leave you with. In your next patient encounter, ask yourself, are you truly co-creating care or still operating on autopilot? Share a story where listening and collaboration changed the outcome, and encourage your colleagues to do the same. Share this episode with your team or peers and start a conversation about what patient-centered care can really look like in your practice. Patient engagement and personalized care are not optional. They are professional imperatives that elevate clinical outcomes, satisfaction, and trust. By embracing these approaches, physicians can redefine quality in healthcare, improve adherence, and build lasting partnerships with patients. Get involved, start learning, explore actionable strategies, and place the patient at the center of every decision. Thank you for joining me on Beyond the Diagnosis. Keep asking questions, reflecting on your practice, and above all, listening to your patients. Let this be the moment where we transform not only what we do but how we do it. What is one insight from this episode that you will apply to your next patient encounter? Leave a comment, share this conversation with colleagues, and help create a culture of collaboration and engagement. Step into the conversation today, contribute your ideas, and explore how personalized care can transform outcomes for your patients.